And I never felt like I really had someone helping to guide me.
Was that causing any impact on, your emotional well-being or physical well-being, psychological well-being?
And it was like, oh, this is something I have to deal with. Some nodules on my thyroid. My last bone density scan last November, that's when I just decided I would start trying to find somebody else that was, and that's when I, in the spring I discovered you. First off, I wish I'd met you 20 years ago.
I was 24,
yes.
So just graduated medical school.
And I will say, right now I feel like you are light years beyond many of your peers that I've met and been treated by. I will say, just even glancing at your wall, this is the first time out of 4 or 5 endocrinologists I've ever had someone discuss nutrition with me. I've always brought it up, and it's always been kind of like oh, that sounds great, go ahead, that sounds great. And so I feel like that aspect of my health has always been sort of my own research, my own path, and I never felt like I really had someone helping to guide me. When menopause hit for me, I was probably somewhere in my late 40s, super busy mom, didn't really, I think, pay as much attention. I think I just kind of went, oh, just, you're doing for your kids at that point, you're definitely, your needs and your health and all of that sort of gets on the back burner. So I first started seeing an endocrinologist when my primary noticed with just a physical exam some nodules on my thyroid. And so had an ultrasound, was just like, okay, we see nothing wrong. We're just going to keep an eye on them. And that happened for several years. I just saw this doctor once a year, would do a quick little whatever, exam type thing. And that's fine. And I never had a DEXA scan from that doctor, even though I was getting to an age where I think, now looking back, I probably should have been asking for it.
Right. So this is one important point that you're mentioning. Anything that is, or when females are in premature menopause, and that's defined as before or prior to age 40, or if it's menopause, around age 50, 53, or whatever the reason for menopause is, the decline in estrogen is going to impact our bone health. So that should be a major risk factor, a major red flag that, okay, we're in menopause, can we just get a baseline bone density at least within the first year or 2 years?
Right.
So that was a key aspect that you're mentioning. So premature menopause, how important bone health would have been other than thyroid.
Right. Yeah. And that was really all that was addressed at that time.
Yes, and that's why I feel that, the time when we spend with any physician, any healthcare provider should now focus on like the entire person, rather than I'm seeing the heart doctor, I'm seeing the gastroenterologist, I'm seeing the thyroid doctor, I'm seeing the diabetes doctor, but where is me?
Yeah, exactly.
Where is me
and not be so much of a you're on your own for that type of, which I felt, my primary at the time. And quick little aside to all of this, I have, since I stopped teaching years ago, my husband's self-employed, so we do private health insurance. And I've been dropped by probably 4 or 5 doctors over the years. They just stopped taking the insurance. When Obamacare hit, I had multiple doctors that I couldn't go to anymore. And even when I tried to do like a private pay type situation, they were nervous because of the mandate. So doctors were like, well, if you're not going to buy the insurance, we'll get in trouble for treating you. It was really a bizarre time in there. It sort of, they worked through it pretty quickly. But so for the longest time, I think I was just kind of like, I didn't have one particular doctor that I stayed with long enough to, I think, feel like I was really getting, a partnership.
Correct.
And how are we going to work through this? And so that's part of the reason why I've switched around so much, is because of that. But as far as going back to those early days, I think I just didn't pay enough attention to my own needs and, you know, maybe be thinking, oh, I should be, you know, working on, you know, talking to someone and saying, you know, am I going to get this, or am I, you know, going to have, you know, a baseline, like you said.
We have a thyroid condition, or, you know, a bone health condition, which could be osteopenia, osteoporosis, or even low bone density in simple terminologies, right? Then what were you seeking? Like, did you end up getting that, okay, let's get the treatment on, or let's look at prevention? Where were you at with your health?
I think I was at more, because initially it was like, okay, this, you know, you're kind of low, you know, bump up your calcium. And I think too, the internet is a wonderful tool, but it's also a very dangerous place to head to without some guidance. And I think I scared myself to death a little bit researching and looking and going down that rabbit hole of, you know, you go on these sites and all these people have so many different opinions, and so, oh, well, I did this and I did this, and then scaring me to death about some of the treatments. And
what was it that you were not getting or receiving, or was unanswered?
Well, I think once it got to the point where I was kind of like, okay, we're going to have to head that direction. My doctor at the time this was 2 doctors down the road, and wasn't pushing for, oh, you have to do this right now, I'm really, really concerned. It was still kind of a mild...
For osteoporosis.
Yes, for osteoporosis, and heading towards. So then there was, you know, which I'd already, you know, looked into and researched some of the, and at the time, that doctor was talking Prolia. And
no hormone replacement therapy that ever was discussed with you?
Nothing whatsoever. Okay. No, it was already, that was the direction that we would head if we were going to start treating it. And she said, if you're having any dental work done, you know, you know, go ahead and do that. And I knew that I had wanted to do Invisalign. I had braces when I was younger, and my bite was all off. You know, later I didn't wear my retainers. And so I knew I wanted to do that. So I said, should I do that first? And she said, probably. So I did that first, and it was like a year treatment. And so then we met again. She had the notes from the year before on the screen, and she said, and nothing really had changed. Everything, I think we'd done another DEXA scan, and it was, I don't know, pretty similar, or at least she erased all what she had written. And she said, I no longer recommend this for you. And I said, and she said that because I wouldn't be able to go off of it.
Sure, yeah.
And so, but then, of course, that freaked me out and made me really nervous, because I'm like, well, what if I'd gone on that a year ago?
There are options that are available for individuals.
So, yeah, so the other options of the bone building, which are the bisphosphonate, right?
Bone building is more teriparatide, so for parathyroid hormone.
Right. So the I'm not sure exactly which ones, but I know I was not a candidate for one because I have GERD. So that was
probably fosamax or
okay. So that one was not. The Prolia was the one that she talked about, and then decided not to. She brought up Tymlos, which is what you and I have been discussing. And I think there was, at that time, have a problem with my insurance that wasn't going to cover it. And so that would have been a battle to get that covered. And I probably would have had to come out of pocket with quite a lot at that point. And then as far as others...
so when we have barriers like cost, right? We have... reasons to not start treatment because you're getting dental treatment, and you know, was there a risk of starting the treatment with Prolia versus not? So there is nothing being done for 1 year, or did you have some options?
Nothing being done other than supplements, calcium,
vitamin D, and magnesium and zinc. Okay. You know, let me just go back to the original question, but what were you seeking? So what was the trigger point that I need to find the cause, or I need to get the root cause of this problem, or I need to fix this, or I need to stop the worsening, because you were getting multiple bone densities.
Right.
And it was worsening.
It was worsening, right.
So what was that?
So
What was the trigger?
The bone density scan, my most recent one, was last November, which is what, 10 months ago. The one before that was a year and a half. So that's the one that she said no Prolia. And so I waited the year without doing anything. My last bone density scan last November, that's when I just decided I would start trying to find somebody else that was, and that's when in the spring I discovered you. Okay. I waited until after the holidays, and then
so almost 4 or 5 years of diagnosis, right? In general, when we talk about osteoporosis, I've seen that in many of the healthcare professionals. Oh, it's not a big deal. Was that causing any impact on your emotional well-being or physical well-being, psychological well-being?
A little bit. Yeah, I think it was always there, and it was like, oh, this is something I have to deal with.
Are there any specific moments that were like a light bulb moment? That, okay.
Absolutely. When you said, let's find out why this is happening, no one ever said that to me. All they said was, sorry this happened, not in those particular words, but the message was, oh darn, you have this. This is what we can do for it. Instead of looking at the one test, the 24-hour urine test, no one ever mentioned that to me at all. And I didn't know that was kind of an important part of finding out what's going on. And now we're treating that. And if something comes of that and it helps, great. But at least it's something that is being looked at instead of. But no, you said, let's find out why this is happening.
Many of healthcare professionals, we tend to just consider premature menopause as it's a part of aging. But getting the right hormone replacement therapy, discussing risk and benefits with our patients would be so important, as that's like one of the first options for protecting bones, improving bone health, improving even the cardiovascular or the heart health. And then once individuals haven't been exposed to hormone replacement therapy for a stretch of 10 years, then it's challenging to start. So, that threshold is going to be very important for us as physicians, as healthcare professionals, to identify, to have the right knowledge, so then that could be advised to the patients. You mentioned about nutrition a couple of times.
Well,
so what did you gather?
I just appreciated that you actually talked about it, I think, partially. I mean, I don't feel like I know everything about nutrition, but I think I'm definitely like ahead of the game of some people that I talk with about it, just in passing or whatever. My friends and all, I'll be like, I have a friend who's just struggles with weight and will eat like a whole bag of candy because it's just I'm like, okay, sugar is one of those things that the more you eat it, the more your body's going to crave it. And if you just cut that out and at least not eliminate everything. I mean, I'm not
But what was specific about nutrition and bone health? Any pointers or anything that comes to your mind that was new to you?
As far as bone, probably trying to find a way to get calcium without using supplements, maybe.
Tell me, how do you envision your health now versus whenever you were struggling with finding the right expertise?
The older I get, the more I am conscious of, and more I kind of go, oh yeah, that's like the other day I was in the pool with my kids, and I used to do gymnastics and so I started doing handstands in the pool with my kids, and I just couldn't believe that my body couldn't do it what I was telling it to do. And I think that realization of knowing that you're not going to be able to do everything the way you used to or the way you thought you could in your head, and your body's not going to respond, but you can still do and be physical and active.
The more positive we are, the more inspiration is coming from within.
Absolutely.
And we'll seek the community support. We'll seek the right care. We'll seek the right expertise. I'm glad that we met.
I am too. Yes.
And thank you for sharing your experience with the world out there.